I'm a psychotherapist. I teach psychotherapy and provide psychotherapy to individuals and couples and sometimes families. And I was trained in a time when psychodynamic psychotherapy was the most prominent type of psychotherapy that was taught and practiced. So my background is fundamentally in dynamic psychotherapy. Well, work with individuals for a variety of issues that they bring, anxiety, depression, loss, grief and loss. I have a wide variety of patients I see with many different kinds of problems, and my way of going about helping them with the problems is a collaborative approach. In other words, I don't pretend to have all the answers, and I try to work with them to help them come up with solutions and behavioral and emotional changes that will help them feel better and function better. Well, I think MUSC, and obviously I've been here almost 40 years, so I've seen a lot of change here. But my impression has always been that MUSC has a nice combination of competence, competent clinicians, and warmth and friendliness, and true concern for the patient's well-being. I hear that from patients all the time, not only those who come to psychiatry, but people who come to the rest of the university for care. Patients and people we as well, sometimes become stuck in kind of a limited view of our choices. And I think one of the things that we do in psychiatry is help people become aware of choices of which they weren't aware, and options for care. I feel very fortunate to have been at MUSC as long as I have. Of course, there have been good and bad times, but never horrible times. And I'm old enough to have been asked to be very heavily involved in the training of psychiatry residents. So I feel very lucky to be able to spend a lot of my time with bright young people, teaching them how to do psychotherapy.